I am a registered nurse and I work at the Cambridge Hospital. I'm delighted to see so many of you here today. Lots of nurses, lots of healthcare professionals, and lots of nursing students, which we love to see. So welcome to all of you. I am looking forward to a great day here at the State House. In fact, this very afternoon, members of the House of Representatives are preparing to vote on our bill to strengthen penalties for those who commit assault against nurses. This is our opportunity to let our voices be heard at a time when real action is going to be taken. Dennis?
My name is Donna Stern, and I'm a registered nurse, psychiatric nurse at Bay State Franklin Medical Center. I love being a nurse. I've experienced almost every form of physical and verbal abuse since I've been a nurse. I have been kicked, I have been punched, spit at, cursed at, scratched, almost strangled, and I've had more than one death threat aimed at me. And I think about other nurses and healthcare workers that have left because of the violence. I don't want that to be me, and I don't want that to be you. I chose this career to help heal people, not be a punching bag. And there must be enforceable penalties for real change to occur. So thank you very much.
Hi, my name is Linda Condon. I live in the city of Brockton and I currently work at Morton Hospital. I have been a nurse for 28 years. I have been an ER nurse for 24 years. Because of the fact that the hospitals have not acknowledged that the workplace is a violent workplace and that they need to take measures to correct this, we then end up being assaulted by these patients. I have been assaulted at work. One time I got head-butted full in the face while I was trying to protect another nurse who had been knocked to the floor and was about to be kicked. Another time I got sucker punched full into the face and got knocked to the floor. It needs to stop.
That the M&A has put forth a comprehensive proposal comprised of 3 different pieces of legislation that we think are critical to alleviating this problem. Number 1, prevent the violence. We have proposed Senate Bill 988. This bill would require healthcare employers to perform an annual risk assessment, and based upon the findings that they get in that risk assessment, to work with their employees to develop and implement programs to prevent violence in the hospitals and the healthcare facilities. Number 2, punish the offenders. Patients, family members, and others must get the message that it is against all, there should not be any violence against healthcare workers, and it will be treated seriously. Number 3, manage chronic risks. This is particularly important to me and my fellow employees at the Department of Mental Health, where we have patients in our facilities who repeatedly assault staff members. House Bill 1931, sponsored by Representative Patricia Haddad, oh, she was there a second ago, would create a difficult-to-manage unit for women, and it would reinstate the difficult-to-manage unit for men. These 3 pieces of legislation together will lead to a significant reduction of the completely unacceptable levels of violence that we see in our hospitals. And we are here today to ask the state legislature to move forward with all 3 of these bills. We like to say we work in the healthcare field, not on a battlefield.
And that is really our goal, is to put things into place that will protect all of the healthcare professionals so that they're able to do their job without these threats.